wellness is an important part of your general well-being. Don't take it for granted. This simply means that there is no better time to take care of your health other than now.
And removing the barriers to the healthy lifestyle choices that we make every day.
Evercare Hospital Lekki presents Smooth Health, a program dedicated to share insightful tips and information to live in a healthier and happier life, featuring qualified and professionally trained medical personnel
whose mission is to make the healthy choice the easy choice.
Tune in to Smooth 98.1 every Thursday at 5:15 p.m.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1, love music, love life. Welcome to the program. If you just joined us, you are just in time. It's time for Smooth Health. And today we're talking all about preventive medicine, its role in your overall health. I've got a very special guest in the studio today, and we're going to be having a conversation concerning this, and we would love for you to be a part of our talk. So feel free to reach out to us on our WhatsApp platform, which is 0809 444 0981. Also, you can call the studio lines. Call the number 01448991. Okay, I'm giving my first three callers and first three texters vouchers, free vouchers from Evercare Hospital for your, for a comprehensive checkup at Evercare Hospital. So without further ado, ladies and gents, let's just dive right into it. Like I mentioned, we're talking about some common cardiac diseases, treatment options available in adults and children. And like I mentioned, to help us in this conversation is Dr. Harish Vaja. Now, Dr. Harish Vaja is a cardiothoracic surgeon of great repute and is one of the leading medical practitioners in South Surat. Dr. Vaja successfully completed MBBS and MS from the prestigious MS Shalom Medical College, and also went on to the United Kingdom for super specialization in cardiothoracic surgery. Also, post super specialization, he worked for 15 years in the United Kingdom, where he proved his mettle as a cardiothoracic and vascular surgeon. Apart from routine cardiac surgeries like CBAGs, that's CABGs, and also valve replacement surgeries, Dr. Harish Vaja has routinely performed specialized and complicated surgeries like aortic root surgery, mechanical circulatory support surgery, that's ECMO, LAVAD, RVAD, and heart and lung transplant surgeries. Now, he joined the reputed Apollo Group of Hospitals and also served as a senior cardiothoracic surgeon for 2 years. He then moved on to Surat, and he was credited to establishing and heading the Department of Cardiothoracic and Vascular Surgery at Kiran Super Multi-Specialist Hospital. Also, Dr. Harish has also led the Cardiothoracic Surgery Department at TriStar Hospitals, Surat, as well as and performed his first ECMO case at TriStar Hospitals. Now, presently, he has joined Evercare Hospital Lekki as the lead cardiothoracic and vascular surgeon, with his vast experience in this specialty spanning, from 3 different countries: the UK, Australia, and also India. Doctor, welcome to the program.
Thank you very much. Thank you for having me
here. All right. So if you're out there, like I mentioned, and you want to, reach out to our doctor today, you want to, send him questions concerning what we'll be discussing, please, once again, call the number 01448991 and also send WhatsApp messages to 0809440981. We're giving 10,000 Naira vouchers to our first 3 callers and texters. So, doctor, let's just dive right into it.
Sure. Thank you.
Okay, so let's start with the basics. What are cardiovascular diseases?
In a very simplistic term, think of it, heart as a pump, and blood vessels are like a tube coming out the pump and the pump circulates volume, either blood or fluid, all around. So when you say cardiovascular system, is essentially heart as a pump and blood vessels as a tube, and the heart pump rotates the blood all around the body continuously. So any diseases which affects the performance of this pump or the heart or the blood vessels will be characterized as a disease of the cardiovascular system.
All right. Okay, I already see the phone lines buzzing. I know that someone or some people are calling. They want to ask questions already. Wow. Okay, let's show up on the phone lines, yes? Okay, hello? Hello?
Hello.
Hi, hello, good afternoon.
Good afternoon. This is Jerry on the line.
Hi, Jerry. You have a question for the doctor already?
Well, I don't have a question yet, but I'm just calling to let you know I'm listening and also if I can win a voucher.
Jerry, right? That's your name?
Yes, Jerry.
Okay, Jerry, please send us your details. Send it to 0809-84820.
Sorry, can you repeat that?
You know what, Jerry, don't worry. Keep listening to the show, and I'll let you know how you can win the voucher, and, just send us your details, okay?
Okay, good.
All right. Well, doctor, let's talk about types of cardiovascular diseases. Okay, so now that you've explained what they are, let's talk about, the types of cardiovascular diseases.
Sure. So let's say first we talk about the pump, the heart itself.
Okay.
So broadly speaking, we all know that with the aging, there is a wear and tear.
Yeah.
So a heart, when you're born, is very healthy heart. But as your age progresses, the disease start to develop and the pumps start to fail. And the commonest cause for this to happen is usually the heart muscle get continuous flow of blood so that it continuously beat. So the blood vessels which supplies the heart muscles, what we call coronary arteries.
Okay.
So they are getting narrowed, and this is because the wall of that arteries get deposits of fat. And the process of the deposition of fat is what we call atherosclerosis. So as a result of this vessel get narrowed and cause what we call ischemic heart disease. So that is the very common problem with the heart muscle or the heart. And then when they don't get enough blood, and if you don't intervene, if you allow the disease to progress, then heart muscles start to die, and the heart as a pump function reduces, and what you get is a heart failure.
And is there a specific age that this can happen to anyone?
Yes, it can happen to anyone. Usually the age is above 40, 50, and because of the lifestyle changes, even it is becoming more common in the younger people as well. What that wasn't the case in the past. So yes, it is a very ominous sign, and awareness is very, very important.
All right, now that you mentioned awareness being important, and you've also mentioned that it's common between the ages of 40 and 50. However, younger people can get it. Is it possible that children can also get cardiovascular disease?
Yes, the second group I was about to mention is that the baby while is in the mother's womb,
okay,
they grow, and all the organs in the body grows, including heart and blood vessels.
Yes.
So due to some congenital anomalies, so the baby born with some defect in the heart chambers or some anatomical and wrong connections, and this is what we call congenital heart disease. So some of these problems are so severe that they need to be attended very soon or within few days or few months of life. Some of them are some intermediate types that the baby could survive for a few months, and when it start to grow a bit more, then you realize the baby is not growing. Find out, you do the test and you figure out that it needs an operation. So this is what we call congenital disease.
Okay.
So some of these people even live longer, and then they become aware of the problem later in adult part of life. That is what we call adult congenital disease. So there's a spectrum of disease for the cardiac problems.
So let me just reiterate what you just said now. So you said some of these people, as it can happen as kids, and then it will grow through as they could carry on this disease as adults, and then they find out that they have it.
Yes. So if the defect is a minor one, and then it may not be apparent until the person start to grow,
okay,
and they start to develop symptoms. obviously sometimes people go for routine physical examination, like sometimes we go into the school, they have a routine examination, you find out heart murmurs and you pick up the problem. But sometimes until the person gets the symptoms, they don't realize it, and once they start to have symptoms, and then you pick up the disease.
All right, thank you very much for that, Doctor. If you just joined us, by the way, this is Smooth 98.1. You're listening to Smooth Health, and we've got the very special guest in our studio today. We're talking about preventive medicine, its role in your overall health. We're talking about some common cardiac diseases, treatment options available in adults and children as well. And, of course, we're having our conversation with Dr. Harish Vaja. He's from Evercare Hospital, and also he's a cardiothoracic surgeon, and he's just leading us through this conversation this afternoon. So to be a part of it, and if you've got questions about heart diseases, cardiovascular diseases, amongst other things, now's the time to call us. Call the number 014489981, or better yet, just send us a WhatsApp message. Send it to 0809440981. So, Doctor, now that you've mentioned that children can also get these cardiovascular diseases, what are some common cardiovascular diseases in children?
So the most commonest is there is chambers in the heart. So normally
chambers in the heart.
Yeah. So there are 4 chambers.
Okay.
And each chamber are separated by partition, muscle partition. So commonest problem you can get is the partition is incomplete. There is a defect. There is a hole between the partition, between different chambers. So these are the common presentations. So we could call it ventricular septal defect, atrial defect, and then you can have a more intermediate variety where there is a problem with the valves associated with the septal defects. So incomplete valves, the valve narrowing, what we call stenosis, so aortic stenosis, mitral stenosis, and then you have a more complex problem where half of the heart is not very well developed, or the circulation is not very, vessels are very well, not well developed. So there's a range of problems, but more complex, they become more rare. So commonest problem I would say is atrial defect, ventricular septal defect.
We're going to circle back into that, Doctor, right after we take these calls. Hello, good evening.
Hey, hello.
Hi, good evening.
Let me say fine.
Hi, fine. How are you doing today?
I'm great. I'm really excited about this topic today.
Say again, Ifeanyi, we can't hear you. What did you say?
I said I'm really excited about this topic today.
You're excited about this topic today. Do you have a question for the doctor?
Yes. I have a question, and hopefully I'm going to win I'm one of the people that will win the gift voucher. Okay, my question is this. Doctor, please, can stroke lead to this cardiovascular disease and also heart failure? Are they part of these causes or common that we see on it?
So you're asking me, thank you for asking the question. Let me get it right. The question is a common cause of cardiovascular disease.
Yes, doctor. Yes.
So as you probably listened earlier, that the process which causes this narrowing the coronary artery, which I was talking about, is atherosclerosis. So the process of atherosclerosis is a natural process, and there are things you do in your lifestyle, in your behavior, which accelerate this process, and you become a victim of this narrowing and the problem. So let's say what are the factors which causes this acceleration? So we know there is an association between obesity, so overweight, and progression of atherosclerosis. Similarly, presence of diabetes mellitus, high blood pressure. Plus, you can also look at your lifestyle. So that if you are having a very sedentary lifestyle, there is a lack of physical activity. That again contributes to this acceleration of cardiac atherosclerosis. People have a habit of smoking alcohol, smoking tobacco, and that also accelerates the process. And alcohol intake. So these are all various things. So this can contribute to progression of the disease. And so people who is when the age advances, you have associated this like a disease like diabetes, blood pressure. So what you want to do is you want to reduce the rate of progression of your atherosclerosis. So you want to make sure your diabetes is well under control, your blood pressure is well under control, you change your diet, you have a healthy diet, you take a low cholesterol, healthy food you eat, Then also you control your alcohol intake, you reduce your salt intake, you do physical activity within your acceptable physical limit, and also you stay away from stress environment. So all this contribute positively and sort of allow you to live longer, because you will slow down the process of atherosclerosis. So you probably will be able to have a lesser consequence because of that.
All right. Thank you so much for that, Doctor. And Ifeanyi, I hope you're able to pick a few things from what the doctor has shared. Ifeanyi, you are our second caller for the show today. So please send us your details, okay? Send them to 0809-444-0981. I'll say that again, 0809-444-0981, because you've won yourself a voucher, courtesy Evercare Hospital. So the voucher is for your first consultation. We have another caller here. Let's see what this person has to say. Hello, good afternoon.
Hello, afternoon.
Hi, good afternoon.
Hi, my name is Emmanuel.
Hi, Emmanuel. Could you please turn down the volume of your radio?
Okay, that's done.
Okay, so Emmanuel, do you have a question for our doctor today?
Yes, please, I do.
Okay, go on.
I want to find out from the doctor what would normally cause high blood pressure.
Is that all?
Is it because of the fact that the artery is always blocked, or maybe there are plaques that lines the wall of the artery that makes blood not to flow effectively, or something?
Thank you for the question. So it's a very good question. So high blood pressure is primarily because of the peripheral vascular disease. So normally when I say all the blood vessels around your body, they are not fixed diameter. They open, sometimes they become narrower. So when you start to get older, they start to become narrower. So the what I call peripheral vascular resistance increases, and then as a result of that, blood pressure goes. So when you take your blood pressure tablet, what it does, it opens up the artery, it relaxes the artery, it increases the size of diameter. This is only one reason. There's also some other reasons as well. Let's say, for example, your kidney. So your kidney is supplied by blood vessels called renal artery. So these arteries, if you get narrowed or stenosis, then the large amount of blood is going into the kidney. The kidney react to that, and as a consequence of a chain event, you have a significant high blood pressure, very high blood pressure, in fact. And if you can able to identify this problem, you can actually investigate and confirm you got a very tight narrowing. You can deal with it by angioplasty, a stent, and you can have a dramatic reduction and control of blood pressure. So it is a multifactorial, but the commonest cause, when no other major cause are found, is because of the increased vascular resistance as the disease progresses, as your age advances, and the artery become more stiffer and more calcified and cause problem.
All right, thank you so much for that, Doctor. We have to go on a quick break, though. When we get back, we'll take some more questions and some more phone calls. But if you want to be a part of our conversation and you're wondering what we're discussing today, we're talking about some common cardiac diseases, treatment options, and treatment options that are available in adults and children. And of course, we're talking about preventive medicine in general, its role in your overall health. To lead us through our conversation, or leading us through our conversation, is Dr. Harish Vaja, who is a cardio-thoracic surgeon with Evercare Hospital. Stay with us. We'll be back after the short breather.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
Driving Lagos.
Simple rules for driving safely around Lagos. Did you know that the highway code has rules about road signs? Traffic signs tell you about traffic regulations, special hazards and other road conditions, speed limits, and so on and so forth. You should also recognize the special shapes and colors.
This is Lagos.
There's nowhere on this earth that compares.
Smooth. Lagos jump. Lagos jamming.
Hey guys, my name is Rachel Kerr, and let me tell you about my Lagos. There's nowhere on this earth that compares. From mainland to island to the roadside soya, there's nothing like that. And of course, the sweltering heat from morning till evening. Now in my Lagos, nothing compares to the weddings. Nothing compares to our parties. But one thing I will say is there's nothing like reaching your land of Lagos. My Lagos, your Lagos.
This is Smooth Health on the Drive.
The global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
Smooth 98.1, love music, love life. This is still Smooth Health. It's brought to you by Evercare Hospital. And if you just joined us, you've missed quite a bit though, but you have missed too much. We're talking all about cardiac diseases, treatment options which are available in adults and children. And of course, it's a general conversation about preventive medicine, its role in your overall health. Now, like I mentioned, leading us in the conversation today is Dr. Harish Vaja. He's a cardiothoracic surgeon with Evercare Hospital. And so far, we've talked about a number of things. So, doctor, we've talked about, types of cardiovascular diseases, if children can get these diseases and, the common diseases in children. But let's talk about the adults right now. So, tell us, what are the common cardiovascular diseases in adults?
Sure. So as I said earlier about the atherosclerosis causing a narrowing of the coronary arteries. So what we call is ischemic heart disease. So these are the most common cause in adult population. And usually they're present with when the lack of blood, less amount of blood goes into the heart and heart wants to work harder. It doesn't get extra blood, then you get a chest pain. So we call angina. So that is the most common cause of heart disease in adult. Other problem is valvular problem. So heart has got 4 different types of valves. So some of these valves get diseased. There are 2 most common problems with the valves. Either the valve get stenosed, get narrowing, and they don't open as you would expect it to open. And second problem the valve gets is that when they close, they are not able to close completely, and there's a leak. A leak goes into the wrong direction. Because normally the valve will allow blood to go into only one direction.
Okay.
So you can have a combination of problem in adult patients. You can have a narrowing of the artery, at the same time they develop valve narrowing or leakage of valve. So they need a surgical intervention if there are significant valve problems. If you have a problem with the blood flow, then you can treat it with either with medical treatment, behavioral changes, which I discussed earlier, and if medicine doesn't control it, then you can use what we call PTCA or coronary stenting, what we call primary angioplasty. And if you have a significant disease, then you have to undergo surgery, what we call coronary artery bypass surgery.
All right. Coronary artery bypass surgery.
Yeah.
All right. That sounds like a mouthful.
Yeah. So that's where my role as a cardiac surgeon. So people who have got a significant amount of disease, multi-vessel disease, where having a stent or only medicine is not good, then we could offer them a bypass surgery. And there are enough evidence to suggest that in this group of patients, you do the bypass surgery. These patients, if they are having a lot of pain, chest pain, difficulty in breathing, so what I call symptomatic, there's significant improvement in the symptoms following bypass surgery. So that's the one benefit. But there is also the second benefit, which is more important, what we call is prognostic benefit, that by intervening, by doing a surgery, you improve their life expectancy. So the symptoms are improved, the quality of life improved, but you also prolong the life. Were you not do anything at all, then their life expectancy will be less, because the disease will progress, heart will fail, and they will not able to live long. So surgery has a definite benefit in a group of people who needs one. Thank you.
All right. Thank you so much for that, Doctor. Real quick, let's get to these questions. A couple of people sent in messages already. This one's from TA. TA says, hello, Doctor. Is an enlarged heart a cardiovascular problem? And what's the probable cause of it? That's the first question. The second question is, this is Samson from Sule. He says, does drinking too much alcohol or having a sleepless night cause cardiac diseases? And our final question, I'm going to circle back on them again.
Sure.
This one says, hello, doctor. I was diagnosed with tachycardia.
Tachycardia, increased heart rate, yes.
It says caused by anxiety. Is this a heart disease, and what's the permanent prognosis? Can it be treated permanently?
Sure. So come to the first question, the enlarged heart. So yes, when I said that heart is failing, so when the heart starts to fail, then normally heart is quite healthy, then it's a reasonable size. But when it starts to fail, then it has to work extra hard. Then is unable to do that. Then it starts to dilate. So when you have a patient who has got enlarged heart, that is not a very good sign, unfortunately. And that heart would have a lesser function compared to healthy heart. So yes, if somebody have and this you can figure it out by doing specialized tests like echocardiogram. Even you can in ECG you can pick this up. So this is very important screening where you can have an enlarged heart, you find out, and then you investigate and find out the cause and treat appropriately. So yes, the enlarged heart has got a significance in that way. The second question was related to alcohol, if I have not mistaken.
It says alcohol and sleeping disorder.
Yes,
really.
So alcohol does not cause direct effect on the heart, but it is a significant risk factor in the sense the prolonged abuse or overdose of abuse for a long period of time will have an adverse effect on the heart. So one has to be control the alcohol intake. There are recommendations how much units you can take, whether it's for the male or for the female. And as long as you can follow it, it should not be a problem. But so alcohol within limit is okay, but abuse and prolonged use and overdose will have a negative impact on the heart.
All right, thank you so much for that. Final one says he was diagnosed with tachycardia. So can it be permanently treated?
So tachycardia is essentially means that your heartbeat goes faster than expected. So when I say there is a normally when you are in a resting condition, so when you are resting, your heartbeat is between around 60 to 80 beats per minute. So when you say tachycardia, when you exercise, your heart goes faster. So then you have a tachycardia then. But you normally don't have a tachycardia in resting conditions. So there are people sometimes who have a heart rate very faster in a resting condition. That's called tachycardia, and that needs to be investigated. Sometimes there are structural causes, some problem within the heart conduction system which contribute to tachycardia, and sometimes it is related to anxiety. But either way, if you want to prove or disprove, there are specific tests you have to undergo in the cardiac cath lab study, what we call test to check the heart rhythm. And once you know that there are no definite structural problems, then you can say that this is a non-cardiac related tachycardia, which is mostly common cause is anxiety, and you can take anxiolytics medicines. If there are structural cardiac problems, there are some specific cardiac medicines which we should be able to control the heart rate, so you can still manage to control it, and sometimes even that fails, and then some interventional procedures can be done.
All right. Thank you so much for that, Doctor. There's so many questions we still have to attend and so little time to talk about it. But real quick, this one from Jari John from Moe says, hi, Doctor. Please, can you tell us how this cardiovascular issues can be detected early, especially in children?
Thank you. So screening is very important. So if you are above 40 or above 50 years of age, if you happen to have a diabetes or hypertension, but you feel you're fine, but I would encourage you to visit the hospital, do routine check. So basically, when you have a routine test, you are looking at ECG, electrocardiogram, you look at your blood sugar, you look at your cholesterol levels. So any of these things are which can be higher up, then be treated appropriately. If the cholesterol is high, you can give medicines, statins to control the cholesterol level. If sugars are high, you want to readjust the medicines so to control the blood sugar, you can do that. Similarly, you can also give blood thinning medicines to control the adverse or vascular events. So I think the test, physical examination and blood test is a crucial part. Even though you are not having any symptoms, to visit the hospital.
It's important to still get yourself checked first.
Yes, very important, very important.
So now that you've mentioned, these treatment options and diseases in adults and children, are these treatment options available at Evercare Evercare Hospital?
Sure. Evercare Hospital has a full independent cardiac services, so we take care of everything. So to start from, as I said, about the screening, physical examination, blood tests, basic blood tests, then cardiac-related blood tests, ECG, echocardiogram, stress echocardiogram, then catheter study. So if you needed, say for example, angioplasty, so we have a range of fully functioning cardiac catheterization. We have a full-time cardiologist available with us, so we can do all this necessary procedures if required. And in the cases where the patient needs surgery, let's say for example, then it's bypass surgery, we have a fully functioning unit. We have well-trained staff. We have established ourselves, and we started doing cardiac surgery at our Evercare Hospital.
All right. Well, cardiac surgery, now you perform that at Evercare Hospital. Real quick, though, let's talk about, other things related to Evercare. So we know that Evercare Hospital is at the forefront of transforming healthcare in Nigeria, with talents such as yourself. Could you tell us the cardiac infrastructure, right? The infrastructure that's available at cardiac infrastructure treatments that's available at Evercare, and also could you highlight some of the teams and talents that are available?
Sure. So as far as the cardiac surgery is concerned, it's not only about doing an operation in the theater. So you need obviously well-trained staff, the anesthetist, the perfusionist who runs the heart-lung machine, surgeon, the assistant, the whole team.
Okay.
But that's only one part of the equation. Then you need an infrastructure to take care of this patient in intensive care units, fully functional intensive care units, which can be monitored by the experts, intensivists, round the clock. And at the same time, subsequently, they need to be looked after in the ward. There is also allied specialties like physiotherapy, blood transfusion services, if they need any products, blood transfusion products, so full-fledged blood bank. So there is a gamut of all this other support group we need, and then sometimes you need some extra advice. So Evercare Hospital has got not only the full cardiac services and cath lab, but we have all other specialties as well. So the patient will have complete care, fully investigated and looked after. And I also want to reiterate that the surgery is all about not about performing the surgery, but the aftercare, lead by us, and we are based at Evercare full time and round the clock, so we can assure all our patients very highest degree of care to the international standard.
All right. Thank you very much for that, Doctor. I'm sure the good people out there listening to the show would be wondering how they can reach out to you, just for checkup and other things, how they can reach out to you at Evercare Hospital.
Evercare Hospital is location-wise, it's in Lekki, Phase 1. So let me precisely say address. It's number 1, Admiralty Way, Lekki Peninsula, Scheme 1 in Lagos. Our website is www.evercare.ng. And our Evercare Hospital switchboard can be contacted, the number 081 398 50710. You can also get information by sending an email to info@evercare.ng.
All right. Thank you so much, Doctor. It's been a pleasure. This has been very, very insightful. If you just joined the show, by the way, you've missed almost everything. In fact, literally everything. Today, we've been talking all about cardiac diseases, treatment options available in adults and children. And we've been having the conversation with Dr. Harish Vaja, who is a cardiothoracic surgeon with Evercare Hospital. So he mentioned just now that if you want to reach out to the good people at Evercare Hospital, their location is at number 1, Admiralty Way, / Bistola Jerusalem Drive, Lekki Peninsula Scheme 1. And also you can reach out to them via their website. Just check out www.evercare.ng. Also call, the customer service there. What the number is 081-3985-0710. And also you can send an email to info@evercare.ng. Doctor, a pleasure having you here.
Thank you very much.
Look forward to seeing you again.
It's a pleasure to talk to you. And my final message to all my listeners,
yes.
Thank you very much for listening to me. I would just only say that as far as health is concerned, everybody has to be a little bit greedy about themselves and do not take their health lightly. Any problems, please contact expert, Evercare or any other hospital, nearby doctor. But please look after yourself. I wish everybody a safe good evening. Thank you.
All right. Thank you so much, Doctor. Stay with us. There's more to come. This is Smooth 98.1. Don't go anywhere.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.